Good morning, members. I call to order the meeting of the Subcommittee on issues relating to the support for persons with disabilities. We have colleagues from the Labor and Welfare Bureau and the Social Welfare Department here. Item 1 on the agenda, residential care services for persons with disabilities. Would members please refer to LC paper number CB bracket 1420/25/01 and CB bracket 1420/25/02. May I now invite the Undersecretary for Labor and Welfare, Mr. Ho Kai-ming, to brief us on the paper submitted by the administration. Undersecretary Ho, please. Thank you, Madam Chair, members. This paper briefs members on the provision of residential care services for different types of persons with disabilities by the government. We have over 10 types of disabilities as defined by the World Health Organizations. So the residential care services for PWD will be more complicated than those for the elderly. We want the PWD to develop their physical, mental, and social capabilities to the fullest extent possible to encourage their integration into the community. To assist persons with disabilities who are unable to live independently or be cared by their families, the SWD provides various types of residential care services. In March 2022, the government have incorporated the planning ratios for rehabilitation services into the Hong Kong planning standards and guidelines. The planning standards is 36 subventive service places per 10,000 persons aged 15 or above. The government adopt multi-pronged approach to offer rehabilitation facilities, including making better use of space in existing subvented homes, purchasing places in private homes, providing welfare facilities and suitable government development projects to identify vacant government properties and school premises, as well as vacant non-domestic premises in suitable public housing estates. On the manpower planning and training in the social welfare sector, to meet the enhanced staffing requirements of RCHDs currently in planning or construction stage and the pressing demand for manpower, we have various schemes, including the training sponsorship scheme, navigation scheme for young persons in care services, enrolled nurse general training program for the welfare sector, special scheme to import care workers for residential care homes. Regarding the findings and recommendations of the review of manpower for healthcare services in the residential care homes, the SWD engaged a consultant in July 2023 to conduct a holistic review of skill and qualification requirements. And the SWD established the Steering Committee on Review of Manpower for Healthcare Services in RCH to offer advice and steer on the study, and we have reported the results of the report to the relevant panel. 4 recommendations were put forward, which was adopted by the SWD, including establishing a brand new professional rank of Health and Care Practitioners, HCP. We're going to implement the recommendations progressively. Thank you. Would members who would like to put questions, please press the button. We have ample time today. Each member will have 5 minutes, including question and answer. Dr. Teck Chi-yuen, Deputy Chairman, please. Thank you, Madam Chair. I thank the Undersecretary for briefing us on the residential care services for PWDs. It is said that the government is committed to help PWDs to integrate into the community, and in the annex, it sets out the service types as well as the capacity of the service offered to the PWD so that we can have a grasp of the current situation. The purpose of today's meeting is to see how we can enhance the service for PWDs and to assist them further. I have some questions regarding the numbers. It is said in the paper that the service quotas and waiting times for RCHDs are as follows. For persons with physical disability in 2019 to 22 is 27 months, but for 22 to 23, the waiting time is 78 months. For persons with mental disabilities, they have to wait 180 months. For people with severe mental incapacity, they have to wait 171 months. So the demand is greater than the supply. The Undersecretary said that they're going to increase the supply in the future, but it seems that there is a huge gap between demand and supply. I'm worried that we will not be able to help PWDs develop their physical, mental, and social capabilities or help them integrate into the community. For persons with physical or intellectual disabilities who need to be taken care of in the RCH, they have to wait for more than 10 months. We've been talking about this issue in the social welfare sector over the years. I wonder if there is a projection on the demand and supply. The Undersecretary said that we're going to have more service places. I wonder if there is a long to medium-term projection. I wonder what challenges the government face. In coming up with the medium-range projection, so that we can offer the government some advice. Thank you. Undersecretary. Madam Chair, I will ask the Commissioner or the SWD to supplement. Residential care homes for the persons with disabilities are diverse. For elderly, we have residential care homes. We have purchased places. And however, for persons with disabilities, we have 11 types of residential care homes for them. Because different persons with disabilities have different needs, it's difficult for us to greatly increase the supply of service places. It's hard for us to seek places in the Greater Bay Area because the cost involved is substantial. We should not pass the burden on to the other cities in the Greater Bay Area. Also, we have an aging population. Dr. Tick's been in the social welfare sector for so many years. For persons with severe intellectual disabilities, they usually pass away at they're 30 or 40 years old. But for persons with severe mental incapacity, they now age some 60 years old. This is a great thing, but that will affect our estimates because in the past, the turnover time is much shorter. I will see if the Commissioner or the SWD have anything to add. Thank you, Madam Chair. I thank Dr. Tick for the questions. We are aware of the long waiting time for service places. In the 2020 policy address, we have formulated a medium-term plan, and we said at that time that we're going to increase the service places for different types of residential care services to 39,900 in 2028-29. We're going to formulate another medium-range forecast to solicit more resources. However, we are offering services to those on the waiting list. Assistant Director, please. Thank you. For PWDs waiting for residential care services, persons with physical and intellectual disabilities receive day training in the community, along with other support services. Now, I have something to add regarding the waiting time. The information provided by the Legislative Secretariat stopped at 2022-23, but since 2023, the waiting time for some services have dropped. There are two reasons to it. First, there is an increased supply from new institutions. There is a integrated rehabilitation center in Siu Lam offering some 1,500 service places, and this shortened the waiting time. We believe that in 2024-25, the waiting time should be able to reflect the increase in supply. This is one of the reasons. The second reason is that since March 2024, for residential care services that has a long waiting time, we have come up with a non-active waiting list because some people tend to apply for the service just to play safe. Now we move them onto a non-active waiting list so that when they actually have such a need for residential care services, they can be allocated a service place faster. After implementing such arrangement, we see that some 10% to 40% of applicants are being moved to the non-active waiting list. As a result, the waiting time for some services have decreased. Madam Chair, I find the numbers offered very meaningful. Can you give us the figures, say the number of people on the active and non-active waiting list? We meet here to improve our service. So apart from managing the waiting list, we hope that there will be a medium to long-term plan. For RCHEs, we see great improvement. For housing department, they also work on the subdivided units that are subpar, and now we have basic housing units. So I hope that the Social Welfare Department and the LWB will work on residential care services for persons with disabilities. Do we have a KPI on the waiting time, say shortening the time from 10 years to 5 years? 5% of public housing is for social welfare facilities. We used to have a shortage of land supply. Now the problem is gone. So I wonder if the LWD will give us a plan on how they will improve the residential care services for PWDs. Please give us some information on the waiting list for residential care services for PWDs. Professor Chen Wing-Kong, thank you. One of my questions is similar to that of Dr. Take. Just now, he talked about the long waiting time for residential care service place. I wonder if the administration have a goal. And I wonder what measures they will adopt to shorten the waiting time. This is a question that we all concern about. Second, on manpower for RCH, I wonder what is the ratio of care workers to patients in RCH. We've seen abuse cases in residential care homes, even sexual abuse. Although there are very few of them, but one of such case of abuse is one too many. I wonder if there is any measures to prevent such abuse from happening again. Are we going to review and improve the monitoring mechanism for residential care homes? Undersecretary, please. Thank you. Regarding KPI on the waiting time, we have to look at our resources. We will try to build more residential care homes. But given the tight budget, I'm not sure if we can offer more residential care homes. The residential care homes for PWD ordinance is amended along with the residential care homes for the elderly ordinance. We want to increase the number of care workers in the market. We may not be able to hire enough workers locally, but as mentioned, we have different programs to attract young people for joining this sector. We try to do our best. we're going to increase the quotas for the importation scheme. We're going to increase the number of quotas in the coming 3 years, hopefully to alleviate the manpower burden. As for individual cases, we're not going to comment on that, but we do have guidelines asking the residential care homes for PWDs to install CCTV. As for the cases that the member mentioned, we detected them by watching the CCTV. So as you can see, our arrangement is effective. But there's always blind spots in CCTV, but we're going to continue to review the arrangement. Hopefully, more PWDs can live safely in the homes. I will ask the SWD to talk about the manpower arrangement.
Hi.
Mr. Ng? Well, perhaps I want to touch on the manpower ratio of the various types of residential care services. For the enrolled nurse and the registered nurse, they also people taking care of the severely handicapped person. So for every 50 patients, we have 1 registered nurse and 7 enrolled nurse. For the persons with intellectual disability, for every 50 patients, there is 1 registered nurse and 4 enrolled nurse helping them. For the moderately mentally handicapped hostel, the ratio is lower. They would need 1 registered nurse for 50 patients. For the severely physically handicapped, it is also the same ratio, 1 registered nurse to 50 patients. That's all. Thank you. Any follow-up questions, Mr. Chen? Well, I actually have a suggestion. To take care of PWDs, you need a lot of patience and care. I think we have to reduce the manpower ratio so that they can take care of fewer number of PWDs. We have to look at the psychological effects on the carers as well, and also give them some respite time. I think we should try to reduce their workload in order to reduce abuse cases. Next, Mr. Andrew Lam. 2 questions. At the end of 2023, you have rolled out a scheme to encourage the private sector to build RCH in private developments. It's supposed to be a 3-year scheme. I think about half the time of the scheme has passed. So I would like to know whether the same principle for encouraging RCHEs is being applied in this case. It seems that the scheme is going rather slowly. For the RCHD, I would like to know for the past 1.5 years, how many cases have you received under the incentive scheme for RCHDs, and what are the challenges faced by the private developers? Secondly, it is stated in the paper that for the mildly mentally handicapped children hostels, the number of places have not increased since 2019. So I would like to know what can be done to increase the number of service places from the point of the review of the service. What is your view on that? The small group home for mildly mentally handicapped children. Well, the incentive scheme is being rolled out in 2023. And the market has experienced some changes since then. So far we have not received any application. We think that it is subject to the planning of the private developers' own development plan. So we hope that there may be applications coming forward, but so far we haven't received any yet. On the increase of places for mildly mentally handicapped children, I think it is just a question of priority, because we need a waiting time for many of the different types of RCH. So we may have a quarter priority to other types of RCH service. Maybe I'll defer to the Assistant Director to see if you have anything to supplement. Chair, I would like to supplement. We have the incentive scheme for building RCH in private developments. We want to do that because some of the religious organizations, they want to make use of the land under their purview to build RCHDs. But unfortunately, they do not have that for the moment, and they do not want to run RCHEs. So that's why for the incentive scheme, we have tried to encourage the RCHE scheme and refined it so as to roll out another incentive scheme for building RCHDs in private developments. But as the Commission has pointed out, because of the market developments, we hope that there will be some religious bodies who would come forward to make use of the incentive scheme for RCHDs. So that's the origin of why we introduced this incentive scheme. Just a follow-up. We understand that for these schemes, the initiative is with the private sector. But if we have a policy, we have already have half of the time of the scheme operators. So we need to see how we can encourage private developers to come forward. We should be more proactive because another 1.5 years will pass very quickly. So I do not want to see that by the end of the scheme, you still don't have a better grasp of the scheme, and see if whether the conditions under the incentive scheme can be made more attractive for the private sector to come forward. As the Undersecretary has pointed out, RCHDs are more complicated than RCHEs. You have more types of RCHDs. So I can see that if an organization is not familiar with the operation of RCHDs, they may not be willing to come forward because they may not know how to operate such. They don't have the experience to do so. This is what I've gathered from my indirect experience of dealing with private developers. So I think the government should take more initiative, be more proactive, so as to push for the first step to be taken forward. So please make good use of the 3-year pilot scheme for the incentive scheme for RCHDs. Try to study the scheme in greater detail. Next, Ms. Lillian Koch. Thank you, Chair. Well, the administration has said that they have been looking into the RCH service for a long time. And I know the waiting time is very long. It can be over 10 years. So I think we really need to do something about the waiting time. It is really a matter of concern. But we can see that the new term of government is proactive, and they say that they are rolling out new measures. There is cooperation with the private sector, and there will be a new rehab service complex to be set up in Siu Lam. Well, I have some concerns. First, we're now talking about caring services here. So apart from the care workers, the medical workers, I think there are different types of professionals involved. But for the different types of hostels, the different types of professional staff required would be different because you're dealing with PWDs with different types of disabilities. But I do not see such information in the paper. You have not spelled out the number and type of staff you need for the different types of PWDs. So we know that we have a shortage of nurses, but what about other types of staff needed for the RCHDs? So apart from people with basic care knowledge, we also need operational therapies, psychological therapists, etc., and also nutritionists. They are all needed, but I do not see the information available in the paper. So can the administration supplement on that? If not, please provide the information in writing later. Please also let us have an assessment of the professional staff that is required for the RCH services, and then how many staff are actually working in the sector so that we can know whether there is a big gap and shortage of staff. The second question is about safety. We are now talking about hostels. I think safety is the first issue for hostel, especially for the parents and the family members. They do hope that the PWDs will live safely and happily in the hostels. But it is very sad that I have come across cases where some of the PWDs living in the enclosed hostels, they can still get out of the hostels and accidents have happened. So I would like to know whether the administration can tell us in the past 5 years how many such cases have happened. For example, they should be stay inside an enclosed hostel, and yet the PWDs are able to get out of the hostel by themselves without anyone noticing it. And then how many of them incur accidents? And then maybe their family members would commit suicide because of that. On this issue, I think it really points out that there are gaps in the caring services being provided in the hostels. So for the administration, do you understand about this problem? Have you investigated into these issues? And how are you going to address the matter in the future development of residential care services? And also whether you would make use of technology like wristbands or other technologies to take care of the PWDs, and also how to enhance your staff to use technology. I would defer to the Social Welfare Department. Mr. Ng? On Ms. Kwok's questions, she asked whether for the RCHDs and the day centers, whether there would be cases that PWDs would run away from the hostels. I would like to explain that for the day centers and for the residential care services, they are not really that enclosed. These facilities are in the community, and we encourage them to come out to the community and integrate with other people. But for the service users, there may be individual cases whereby some of them have ADHD. So for these organizations concerned, they would know about the background of the service users. They would not sort of refrain them from leaving the facility, but there may be chances that they will leave the facilities. For such situations, then the service units would have measures to deal with that. For example, if they open the main door, there will be an alarm warning for the staff. And then also we would put in devices like GPS on the service users, so that we'll be able to track them. And this will facilitate the staff, as suggested by Ms. Kwok, that we make use of technology to take care of the service users. I think the important point is to teach them how to integrate into the community and how to live in the community. Because we are not trying to restrain them within a hostel, because they will be curious about the community outside. So for the direction that we're going is that we want them to know more about the community, and we hope that people in the community would embrace our service users. And if they know that they have run out of a center or a hostel, they would help them to get back to the facilities concerned. They would report to the police, for example. Thank you. Well, Chairman, I don't think the administration has answered my questions. On the manning ratio, please provide the information after the meeting. The second question is about the service users running away from the facilities. Do you have the figures in hand? It is impossible that you don't have the number of cases where the service users have run away from the hostels. I ask such question because I have come across such cases. It is for these enclosed hostels. It is because of the assessment by the service provider that they are not allowed to leave the hostel, and yet they have left the hostel by themselves, and there are accidents incurred. So we have to really address the issue. So please look into the matter and see what has happened, and then try to review the safety issues. Otherwise, how can we and the family members put their heart at ease and leave their family member to you at the hostels? Well, I would defer to the Commissioner to provide the statistics in future. We do not want to comment on individual cases here. We are residential care services. It is not a prison. Well, I do not know which case you are referring to, but as the Assistant Director has pointed out, we want them to integrate in the community because they have just moderately physically or intellectually handicapped. So please provide the information to SWD and we'll try to follow up. Chair Lady, I would like to supplement. If you want me to touch on the specific cases, then I think you should look at your reporting system as well.
資料，但係寫
Madam Chair, one more point. The SWD does have the relevant information, but I'm not sure which case the member is referring to. We do have a notification mechanism. After the meeting, perhaps the members can browse our website. My last word, Madam Chair. The case I talked about is about safety of PWDs in care homes. And I propose suggestions based on the case that I raised. Next, Ms. Doreen Kong. Thank you, Madam Chair. I'd like to commend the government for the Integrated Rehabilitation Service Complex in Siu Lam. I know that some gerontechnological products have been introduced into the complex. I wonder if the government have any plan to introduce the relevant equipment and technology into other care homes to improve the efficiency and quality of services. Second, I'm glad to hear from the Undersecretary that care homes are not prisons. I'm not saying that they are. In the past, I have been meeting with family members of PWDs who are staying in care homes. They understand how hard it is to work as care workers in care homes. And it's no easy job to take care of PWDs. I've written to the administration previously. I'd like to ask about the management model of the care homes. After COVID, I know that some of the care homes are still not fully opened. For residential care homes that have not been fully opened, are they neglecting the mental needs of a PWD staying in those care homes? Some family members of PWDs told me that they are willing to work as volunteers in the care homes to alleviate the manpower burden and to increase the service offered. And they're happy to work with the care homes. So I wonder if the administration will allow the family members of PWDs to work as volunteer so that they can meet with their family members more. I think that this will enhance communication between the family and the care homes. Thank you. Undersecretary. Thank you, Ms. Kong, for the question regarding the Siu Lam Integrated Rehabilitation Services Complex. We have applied smart technology. Actually, in other residential care homes, we are also using information technology to assist. We are using the gerontechnological fund. As for the visit arrangement of families in residential care homes, the licensing office of residential care homes sent letters to all residential care homes in March 2023, saying that all residential care homes should be fully opened and resume the arrangement to before COVID. The care homes will look at, say, the breakout of influenza, and they may tighten the arrangement from time to time. But I think that there shouldn't be any restrictions to families who want to visit their relatives in care homes. As to whether we should facilitate communications between families and care homes, and as to whether we should allow family members to work as volunteers in residential care homes, we do support that. We think that the care homes should enhance their transparency. They should communicate with the family members more. But as to the extent of participation, it depends on the operation of the residential care homes, because the care homes is a place for community living, and we have to have regards to the privacy of other users in the care homes. Family members who work as volunteers may go in and out very often. We encourage, however, the care homes to work with family members more often. Madam Chair, I have one more point to add. I hope that the administration will strike a balance between privacy and the rights to visit, because a conflict may arise as a result of these issues. Next, Ms. Chen Hua-Yan. Thank you. There is great demand for manpower in residential care homes. I know that there are additional service quotas, but I'm worried about the quality of service offered. I know that the government conducts surprise inspection, but will the administration offer standard training for imported care workers on, say, their language or basic care skills? We need to ensure the quality of manpower that is imported. The SWD has a training sponsorship scheme. For medical practitioners, they have to undergo regular training, say a few times a year. Are we going to implement a similar scheme? I am also concerned about tetraplegic patients. I see that there is only one home for tetraplegic patients offering some 20 service places. That is the Transitional Care and Support Center for tetraplegic patients. For patients that need respiratory devices, there's only 2 quotas for them in the support centers. Tetraplegic patients need such transitional care and support. Some other patients are waiting for other care homes. For patients that are suffering from physical disability, they used not to be able to live to an old age, but now, given the aging population and as the lifespan of people with disability has become longer, I think that the waiting time should also become longer. So I wonder if we can increase those service quotas for the Transitional Care and Support Center for tetraplegic patient. Given the aging population, do we have a projection on the supply of places in residential care homes? In the coming few years, perhaps we should increase more service places, because otherwise the waiting time will only get longer and longer. With our enhanced medical service quality, the aging issue will only get worse. Thank you. Under Secretary, regarding question about care workers, primary 6 graduates can become care workers. There is no threshold for entrance. So for mainland care workers imported to Hong Kong, they will have to, first of all, undergo a course. Some Hong Kong residential care homes hire mainland care workers as they were still in schools. And such recruitment exercise is of a larger scale. For smaller residential care homes, they may conduct their own training. We may talk to the mainland authorities on some other arrangement to allow the care workers take training on the mainland first before coming to Hong Kong. On language training, well, we are not able to hire workers in the Guangdong province because the salary there is high. Now we're trying to recruit workers from Guangxi. I think that the residential care homes ask the care workers to speak Cantonese to make sure that they can communicate with the patients and the family members. The source of workers mostly is from Guangxi. I will ask the commissioner to supplement. Thank you, Madam Chair. I thank Ms. Chen for the question. We don't have a projection on the aging situation for PWDs, but as you can see, our medical service is of high quality, so the PWDs is also aging. We see an increase in demand in the foreseeable future. We'll try to catch up with our supply, and I believe that technology will be of help here. We may be able to introduce equipment and technology to allow a single care workers to care for more patients. As for the tetraplegic patients, I will ask the Assistant Director to talk about that. Ms. Chen just now talked about service offered by a center. We do have an integrated district rehabilitation center. Is now provided for under a pilot scheme. There are only 2 of such centers currently, but in the future, we plan to provide for some 14 such rehabilitation centers in different districts for people who are severely and moderately physically handicapped. For tetraplegic patients, they are usually taken care of at their own homes. Some of them rely on respiratory device. We do have a integrated support service for such patients to offer care support at home. So they are well supported, not just by the Day Community Care Center. Next, Mr. Vincent Chang. Thank you, Madam Chair. I'd like to ask about the supply of residential care home service places. According to paragraph of the 5 of the paper, it is said that the government is adopting a multi-pronged approach to provide more rehabilitation facilities. Some 5 years ago, the government set aside $200 million to purchase premises to provide for such facilities. Only 2% of the balance has been spent, however. Are you going to purchase more premises for PWDs? Now the property market is going down. Do we have more room to purchase more of such home premises? As we all know, I am concerned about transitional housing, and usually the ground floor of transitional housing is set aside for PWDs, and these facilities are often operated by social welfare organizations. We may be able to offer, say, transitional housing for PWDs or halfway houses for PWDs. Can we provide for such facilities in the transitional housing. We have now a well-being concept for public housing to make things and the environment more convenient for the PWDs. Have you been working with the housing department on this well-being concept to set aside spaces in public housing for PWDs?
Undersecretary, I'll take the first question. Thank you, Mr. Vincent Zhang. We haven't thought about make use of transitional housing to be used as residential care homes. On the first question about the $20 billion question, it is not a question of financial resources. The question is whether we can really find the suitable places, because all the buildings would have to be less than 24 meters and it has to be commercial, residential, mixed-use buildings. So it is not easy to identify them. We may have a hostel of about 100 places, and then we would need about 50 to 60,000 meters square for the purpose. Recently in Guntong, there is an NGO who want to rent premises for the purpose. But unfortunately, there is strong objection from the neighbors nearby. Well, I do not want to speak in English, sorry about that. It is difficult to identify places for RCHEs. It may be easier to find premises of RCHEs. So at the end of the day, we have to look for other solutions. So it is not just a question of money. It is also whether there is a supply of suitable premises under 24 meters, which is 6-7 stories high, and whether they are residential, commercial, mixed buildings, and there are no UBWs, so it is not easy to identify such premises. So that's why it is difficult for us to purchase such places. I will defer to the Commissioner for supplementary information. I think Mr. Zhang has raised a very good point. If the PWDs can continue to live in the public housing estates, it will be nice. Actually, the Housing Department has looked at the menu for accessibility for PWDs, and they try to find suitable places in the PRH under their purview. Any supplement from Social Welfare Department? Mr. Vincent Zhang? Well, I have listened to the explanation put forward by the Undersecretary on the $20 billion question, because you have only buy a few number of places. There are so many premises available in the market. So please be more proactive and try to identify suitable ones and purchase them. I also hope the administration will take into account my suggestion. The SWD and the Housing Department collaborate together, for example, like having community sitting rooms. And I hope the SWD can take an initiative and try to find more low-income premises, because all the transitional housing is used by the service users of SWD, and they have the support from the social workers concerned. So I hope that you can devise a scheme to help them. Well, thank you very much, Mr. Zhang, for this suggestion. We'll go back and look at it. But we do not want the service users to be moved from one hostel to another. For transitional housings, they are transitional in nature. So there is a time bar on the usage of such premises. In the past, for the RCHEs, we may only be able to get a piece of land for use for about 10 years, and we worried about what will happen after that 10-year period. So this is a worthwhile suggestion. We'll definitely look at it, and we hope that the land will be available to us for use for a longer time. 2 more members would like to ask second round questions. For the second round, 3 minutes per member, please. First, Deputy Chair, Dr. Tick. Well, Chair, actually, thank you for allowing me to ask my second round of questions before your first round of questions. We are now talking about residential care homes. We've been talking about that for an hour. but we haven't got much from the administration. I'm not optimistic about the future. You have $20 billion in use, and the administration has been talking about the difficulties they face. If you cannot purchase suitable premises, please give us the money for use by the welfare sector. You want to cut our budget by $1.5 billion. If you give us the money, then we don't need to cut our budgets for some 10 years. Well, for the special size scheme, it has been in place for some 20 years, and you only have a few number of projects under that. That means the NGOs make use of the land to build welfare facilities. For the private development, the incentive scheme, you do not have much progress because they are afraid that the welfare facilities will affect their property prices in the private sector. Well, I just want to quote a few examples because we have a lot of proposals, but they are not that effective. The Undersecretary has said that even if there is a piece of land available, do you have the financial resources? If there are 15 land parcels, is it possible for you to get the financial resources and the manpower to operate the welfare facilities? I think you need to have a medium to long-term financial plan. Commissioner, you are a good person and you are an expert in this area. I hope you would have a better planning. Don't come to the Center for Financial Resources every year. You should have a good planning. Secondly, let's look at the waiting list. You ask people to wait for 10 years for service. This is not humane. So what support services are you providing for them during this waiting time? For the elderly, you have the voucher scheme, you have the home service provided for them. So during the waiting time, they have been receiving services. So can you do similar things for the PWDs while they are waiting for a place in the hostel? Can you come up with some support services for them? Can you make use of resources from outside the government for such purpose? If you have a plan to meet the demand, then that will be a good thing. If you cannot match the demand and the supply, and during this gap period, you should come up with measures to support the service users and their family members. So, Commissioner, can you come up with a plan and tell us what you are thinking about? Undersecretary, well, during the waiting time, we actually have talked about the support services for the PWDs during the waiting time for hostels. Well, you don't have to repeat yourself. Well, if you have sufficient provision of service, we don't need this meeting at all. So I would like to know in future, how are you going to help them? You are just giving us an account of your existing services. But you now have a waiting time of 10 years. It is unacceptable. If we are happy with that, we don't need this meeting. So for the service users, we hope that you would have better planning and more resources for them. For the elderly services, I'm happy with it. But I hope you would be using the same proactive approach to deal with the services for PWDs. Well, we note your point about the use of the $20 billion. For the special scheme, we are actually having some of the projects that go into the detailed design stage, and construction works will commence soon. For the lottery funds, $20 billion, they have already been earmarked for projects. So we'll gradually take forward the projects. So we should have some tens of such projects coming on stream. Well, I think we have the determination to do so, but I hope you would appreciate that we are facing constraints. We agree with Dr. Tick that we would try to provide more comprehensive support service for the service users during the waiting time. Next, Ms. Doreen Kong. Chair, a quick question. Mr. Vincent Zhang has put forward a proposal which I fully support. First, I think don't waste the transitional housing that has already been built, and also for the mildly disabled persons, please try to encourage them to live in the community. This is a good move. Well, for the mildly physically handicapped persons and their families, we should try to provide a good living environment for them and reduce the resources that they have to use out of their own pockets. So I hope the administration will really look into this suggestion by Mr. Zhang. A follow-up question on Ms. Chen Hoi-Yun's question. For the elderly hostels, we are having an aging population, and the PWDs have a long waiting time, and we have the elderly caring for the elderly, which is very common. So is it possible for the government to look at the mix of RCHEs and RCHDs? Is that possible? Deputy Undersecretary. Well, thank you for the suggestion. We'll go back and look into it. And we also have to look at the safety issues concerned for the transitional housing. If they can be made available for the mildly handicapped persons, that will be nice. Ms. Kong has suggested that maybe for a couple, they live together. Are you talking about two-person hostels? Yes. For the elderly hostels, we now only have 4 to 6 person hostels, but in the Bay Area, a lot of the hostels have 2-person rooms, and they do not necessarily have to be both subsidized by the government. And for some of the welfare NGOs, when we meet with them, we can see that there may be cases where an elderly is caring for another elderly, and the latter one may be having intellectual disability. And we can subsidize them to live in a third-person hostel in the Bay Area. So the latter one do not have to pay for it. But for the able elderly who live in the Bay Area, the cost is about $9,000 per month. They will have their own bathroom, toilets, and then also there will be meals provided and facilities, activities provided by the organizer. So as Dr. Tick said, so instead of asking for more supply of daycare services, maybe it's better for the couple to go and live in the Bay Area. So don't just think about the daycare service provided in Hong Kong, but try to be more open-minded and look at the residential services in the Bay Area as well. Well, thank you, Undersecretary, for the detailed explanation. I understand that in the mainland there are a lot of such facilities, but I think locally there is a demand in Hong Kong. No matter how costly and how difficult, I think we should look at the feasibility of such. Maybe they will be able to afford it. So please don't preclude this possibility. Please ask SWD to supplement. Well, Ms. Kong has talked about for the mildly physically handicapped persons, accommodation for them. I would like to supplement. At present, we have residential care services for the moderately and the severely handicapped persons. We have supported hostels for the mildly handicapped, but the objective is to gradually help them to integrate into the community so that they can live independently in the community. So for the mildly handicapped person, we have support services for them in terms of residential care. So for the mildly physically handicapped or the person in mental recovery, we try to help them, and we have services like integrated family service centers and also medical social workers who will be able to help them and look at their housing needs. And we make recommendations to the housing department for compassionate housing. So we do try to assist them to get hold of public housing units. So these are measures to help them in the long term so that they will be able to live in the community. So these are things that we're doing regularly. But for the mildly handicapped person, maybe they also need some medical proof, and we would refer them to the housing department for housing. For transitional housing, we also need to see whether they have the need for such, but we rather look at the more long-term housing need and compassionate housing for them. But we do not preclude the use of transitional housing for them. We do make such referrals for the families in need. So this is what I want to add.
Now it's my turn. we've been talking about our support for PWDs, and we know that they are aging. In our discussion, it seems that we have ignored elderly with hearing impairment who are living in residential care homes. We have received complaints from groups of hearing impairment saying that there is no hearing impairment-friendly policies in residential care homes. There is no interpretation or translation services for PWDs in care homes. There is no professional interpreters in these facilities. And there are no relevant devices to help people with hearing impairment. And as a result, elderly with hearing impairment cannot integrate into the residential care homes, and they have difficulty in seeking help. Some are born with hearing impairment. Some develop such impairment because of other illness. So I think that we need to support this group of people. We need to ensure the quality of life of PWDs in their senior years. I think that the residential care homes should respect them. With the aging issue, I think that the administration should look into the provision of relevant services and training for care workers in the 11 types of care homes for persons with disabilities. As we are building new care homes, are we going to provision for special devices to help this group of people with hearing impairment? Are we going to introduce, say, artificial intelligence? For PWDs, hearing impairment may be part of their disability because hearing impairment will not lead to death, but other chronic illnesses. So some persons with disabilities are with hearing impairment along with other chronic illnesses, and that may affect their personality and the character and how they live with other patients in the residential care homes. If we don't have enough support, these PWDs may develop other mental illness as a result. So I hope that the administration will respond to this issue. Thank you. Commissioner, please. Thank you. With the aging population, the persons with disabilities, as they get older, will suffer from hearing impairment. I agree that we need to pay attention to this issue. When PWDs are suffering from hearing impairment, we have to look into the kind of service that we can offer them. When members come across similar issues, please pass the information on to us so that we can look into the actual situation to see if we can use the relevant care homes as a pilot premises to provide for relevant services. We are aware of such issue. Assistant Director, anything to add? As far as I understand, there is gerontechnological devices in residential care homes that are offered to patients in residential care homes to express their wish or demand. For people with hearing impairment, we may need sign interpreters. We will pay attention to the demand of such relevant services. As PWDs get older, their hearing may become worse. I do agree that we need to help these people express their demand and need. I know that the residential care homes are working on it. Because this issue is not limited to RCHDs, but also RCHEs, I see the application of gerontechnological devices, and they may be of help here. Thank you. Second item, financial support for persons with disabilities and their carers. Members may refer to LC paper CB (1) 420/2025 and FS01/2025. Now, may I invite the administration to come in? Thank you. Would the Undersecretary, Mr. Ho, walk us through the paper submitted by the administration? Please turn on the Undersecretary's microphone. Thank you. Madam Chair, members, this paper briefs members on the financial support for persons with disabilities and their carers. The government operates a non-contributory social security system to provide cash assistance for persons with disabilities and other needy persons, including the disability allowance under the Social Security Allowance Scheme and the Comprehensive Social Security Assistance (CSSA) scheme. The assistances are non-contributory, and the amounts of which are contingent upon beneficiaries' disability, economic, and individual circumstances. The DA, disability allowance, is non-means tested and has no age restrictions. The DA's eligibility mainly depends on medical assessment conducted by doctors of Department of Health. Those in need may also apply for CSSA. CSSA has no restrictions and offer disabled recipients with relevantly higher standards rates per month depending on age, family conditions, and level of disabilities. Apart from DA and the CSSA schemes, the government offer other financial support. The goals of these schemes is to subsidize the purchase of care devices, to allow them to hire carers so that they can commute between their homes and workplace. Third, we offer subsidy for rental of medical consumables and respiratory support medical equipment. We offer subsidy also to persons with permanent stoma to purchase medical consumables. We also offer living allowance for low-income carers of persons with disabilities. For disabilities, people with disabilities who do not receive CSSA, they may consider applying for charitable funds administered by the SWD or other organizations to cover expenses for purchasing or repairing wheelchairs or other medical and rehabilitation supplies, etc. The relevant service units of the SWD will assist in referring needy cases based on the eligibility criteria of each fund. We welcome members for the views. Thank you. Each members will have 5 minutes, including question and answer. Dr. Teck Chi-yun. Thank you, Madam Chair. I'd like to know more about this scheme on living allowance for low-income carers of persons with disabilities. The care allowance is $3,000 per month. Are CSSA household eligible for such living allowance of $3,000 per month? Would this be considered a double benefit? How does the government look at it? Because the CSSA scheme is to meet the basic needs of relevant households, but people with disabilities have special needs. And I think that the carers are also special needs of the PWDs. So how come CSSA households are not eligible for such living allowance? Does it mean that the carers are taken care of under the CSSA so that they will not be entitled to the living allowance? Thank you. The Assistant Director, please. We offer living allowance for low-income carers of PWDs. The target beneficiaries is very clear. We help those who don't benefit from OH allowance or the CSSA because they are of low income and they are carers. That's why we want to help them. And we offer them a carer allowance. For carers without financial means, they can apply for CSSA scheme. But this scheme on living allowance for low-income carers of persons with disabilities is different from the CSSA scheme. Madam Chair, I don't understand the logic. For low-income carers, they can get the living allowance. For those receiving CSSA, they're not eligible for this $3,000. So for carers who have better means, they are entitled to the $3,000, but those receiving CSSA don't have means either. So how come they cannot get the living allowance of $3,000? How come CSSA carers are not entitled to the living allowance? I don't see or understand the logic here. We've been talking about this so many times. The PWDs are having a hard time. I think that we should alleviate the burden of the carers. Please look at whether the carers who receive CSSA can live or take care of the PWDs easy. Undersecretary. For CSSA scheme is dispersed on a household basis. So PWDs who are entitled to CSSA, their carers will also be entitled to the same. For PWDs receiving carer allowance, their carers may have a job. That's why we want to give them a living allowance, to allow the carers to take care also of their family members. For CSSA, we already offer a financial assistance to meet their basic needs. I don't think we should give them an extra $3,000 on top of it. Commissioner, please. For the living allowance for low-income carers of persons with disabilities, this is just a form of living allowance. We're not trying to subsidize the carers to take care of the PWDs. That's because the carers may only be able to work part-time because they have to take care of the PWDs, and this is a form of living allowance to help them out. As for CSSA, the cash assistance can support the expenditure of an entire household. They are different. I hope that the administration will look into the pressure faced by carers receiving CSSA. It would be okay if the carers are well taken care of just by receiving CSSA, but the fact is that the carers are faced with a huge burden. Please look into the matter. I understand what you were talking about, but it seems that we have different views. Carers under CSSA scheme also have unique needs and demand. Next, Professor Chan Wing Kong. Thank you, Madam Chair. I only have one question that is, well, according to the paper, most of the financial assistance offered by the government is means tested. Even for scheme on providing subsidy for higher disability allowance recipients in paid employment to hire carers, there is a income assessment for the monthly subsidy of $5,000. So for this scheme on providing subsidy for higher disability allowance recipients in paid employment to hire carers, I wonder what the situation is. How many people receive subsidy under the scheme? Will you relax the income threshold or ceiling to encourage more people to participate in the labor force?
SWD, The scheme on providing subsidy for higher DA recipients in paid employment to hire carers is to cater for recipients of higher DA. The situation is that despite their receiving the higher DA, they still have the ability to take up paid employment. Our consideration is that we want to make sure that public money is put to good use, and we want to prevent abuse cases. So they just try to take up a light job and then try to get the allowance to hire a carer. So that's why we have to put in a means test so that we can try to help those in need precisely. So for the higher DA recipients who are also in paid employment and having subsidy for hiring carers, the number of such recipients is about 50. Chair, just to supplement, well, there is an income test of $30,000, and it is a higher DA, so the subsidy is about $4,000, so the limit is about $35,000 in total. And we provide them with a monthly subsidy of $5,000. So for the income limit, we think that if they are having a higher payment, they can afford to hire a carer with their own resources and do not need the government's help. We appreciate that you want the government to relax the scheme so as to help more PWD so that they can go out to work. But then we also need to see what the other sectors will think about it. We think that the current arrangement is suitable. Next, Mr. Andrew Lam. Thank you, Chair. I have raised this question in the Welfare Services panel, but I would like to follow up here. On the data of carers, you said that you want to be more progressive, Commissioner, but do you have a database? What are the current information there? Do you have a rough estimate? So how many PWDs are out there but not within your network? You talked about privacy and other consideration. I appreciate that, and I know you're working on it. But there is now a lot of information being kept in various departments. So do you have the initiative, or are you proactive enough to try to locate the information concerned and try to consolidate them so that you would have a good database? Commissioner. Thank you, Mr. Lam. Thank you, Chair. Well, I cannot give you a very precise answer. I can tell you that I have a lot of databases. So we talk about the low-income carers. We have a subsidy for them. So we have a database on that. And the SAD also have different databases. The housing department also have their own database about the singleton elderlies and also the elderly couples and how many elderly are caring for the elderly. Well, I do not have the figures at hand. We are trying to discuss with them. So if we can overcome the privacy issue, then we can try to get hold of the information from the housing department and we can share the information from SWD to them. Well, there may be some databases and they contain different data. If we can consolidate them, then we may be able to find out more information about the carers. So we also have to think about, after establishing the database, what do we do with it? We are thinking of a few pilot schemes. For example, we may collaborate with the hospital authority. So if the carer is being hospitalized, so the person who needs to be cared, we will try to see how we can help them. So we need to talk to the HA to get hold of the information, and we will touch on privacy there. So we have to address the issue of privacy first. For the Privacy Commissioner, she has been very helpful, and they have been given us some exemptions under the current legislation which we can make use of. So we hope that we'll be able to address these issues, and we will have good justifications to make use of the exemptions under the current legislation. Then we will be able to consolidate the data in the various databases and try to fulfill some functions. Because if we want to establish the database, we want it to serve certain functions. It's not just about establishing a database and that's it. Well, I would like to be more precise, Commissioner. You said that you've been liaising with the Privacy Commissioner and they have been helpful and proactive. So for the time being, when you discuss with the Privacy Commissioner, my understanding is that you are trying to resolve the technical issues. There is no in-principle objection which requires amendment to the relevant legislation. Is that correct? Well, the direction that we are going, and when we are discussing with the Privacy Commissioner, is that we don't want to amend the legislation. We are trying to make use of the existing exemption clauses under the current legislation so that we can tailor our work to fulfill the requirements for exemption. And then we'll be able to share the information amongst the various departments. So that means the current exemption will be able to cover all the data scattered in the various departments. Is that correct? So such data do not touch on in-principle issues which require legislative amendment. Is that correct? We are trying to look at certain specific exemptions, and we try to consolidate the information. We may need to review each and every case to see if the exemption clause is applicable. So this is not a blanket approval to cover all scenarios. But for the time being, for the pilots that we want to pursue, we think that we will be able to make use of the current exemption clauses. So you do not have a comprehensive list, but for the current list, you think it is adequate for your use. Yes, we think that the current exemption clauses are sufficient for the pilots that we have in mind. Next, Ms. Doreen Kong. Well, I would like to thank the administration for making some progress regarding the database for TWDs. And I think we can look at the legislative framework together and take the first step forward. I would first like to talk about the carers. I understand that we don't have sufficient resources to cover all the carers in society. But for the carers of PWDs, I think we really need to help them. My understanding is that the carers of PWDs, they have to pay a high price and face a lot of difficulties. We are now trying to support the low-income carers of PWDs. But I'm worried that when the cost of facilities or consumables used by the PWDs, the middle-income carers will become low-income carers. So I hope that the administration will try to have policies and measures to help the carers of the PWDs and not just the low-income carers. Dr. Teck has mentioned before that there should be a PWD commission. He also talked about that the PWDs should participate in this commission. We actually had a large number of PWDs in Hong Kong, in terms of the population size. So I would like to know whether the administration is going to pursue what I've just mentioned. The last point is about the policy reform for PWDs. In Hong Kong, I know that we have limited resources. So when we formulate policy, we just try to meet the basic needs of the PWDs. But I hope Undersecretary over time, when we have more resources, we will be able to have a policy review so as we'll be able to provide not just the basic welfare needs, but to give them more resources so that they would live with more dignity. And I would say a few words and then ask the Commissioner SWD to supplement. On the last question by Ms. Kong, we do understand that we have a non-contributory system in Hong Kong and we have a low tax regime. Well, in the case of Europe, maybe they have higher taxes, so they be able to provide more services to the needy, and they have something over and above the basic needs. But we are not starting from scratch. We have to look at what we have done before. We have a low income tax regime and we have a non-contributory system. So we have to see how we can try to find more resources to provide better service rather than just basic needs for the PWDs. Well, we hope that we can follow the user pay principle. And we may need to think more about that in future, because for the PWDs, not all of them need CSSA. Some of them may need medical support, and they have high medical costs to bear. That's why they need CSSA. So I think the administration would need to look at the issue in the longer term. So I would defer to the Commissioner for the PWD Commission. Well, I'll try to take the first three questions from Ms. Kong. Ms. Kong has pointed out very rightly, for the support for PWDs, we do have income requirements and means tests, but you would appreciate that for a lot of the services for the PWDs, they are non-means tested. If they need the service, we will provide them with the service irrespective of their family income. But then, of course, there will be a waiting list and demand is not able to meet supply. But we hope that we can do more. But for the majority of the services, they are not means tested. For the PWDs on commission, we already have a commission on rehabilitation, and there are a lot of PWD representatives on that commission. So when we talk about the PWDs, we also need support from the professionals, the academics, and the other organizations. So for the rehabilitation advisory committee, we also have representatives from PWDs, we have carers, we have government representatives, we have professionals, academics. That is a more comprehensive committee that will be able to address the issues concerning PWDs. On the planning for PWDs, you know that we have RPP, the Rehab Program Plan, and that is implemented a few years ago, and it is being gradually implemented, and we want to do more. For the professionalism mentioned by Ms. Kwong, we attach importance to that. Well, for the last policy address, we mentioned that we want to encourage more PWDs to take up employment, and we hope that through work, they will be able to help themselves in terms of rehabilitation, and they will also be able to earn money, and they will be able to integrate into community.
咁呢方面其實
And also contribute to society and live with dignity. So for this, we do not need a lot of resources, and we want to focus more on that. Well, thank you for your explanation. If we have a Rehab Advisory Committee and we are moving along that direction, I hope that in future, when time is ripe, we can escalate the RAC into a commission for persons with disabilities. I know it is important to have participation from the experts and the professionals, but I think they just focus on rehabilitation. But for PWDs, I think their rights and privileges would have to be taken into account as well. So I hope that over time we're able to upgrade this RAC. SWD? Well, thank you. I want to talk about the allowance for the carers. We want to be more relaxed. Of course, it it is different and it has to be separated from the CSSA. But for the design of the living allowance for the low-income carers, if they have to take care of more than one person with disabilities, the maximum amount of allowance is $6,000 per month. And if they try to take up courses concerning the caring of PWDs, the course fees will be fully reimbursed, even if the traveling expenses for attending such courses could be reimbursed. So we hope that the carers and the PWDs do not have an employer-employment relationship. They live together, then they will be able to receive the allowance. So for the design of the scheme, we try to be more relaxed. And for the person being cared of, whether they are receiving a DA or the elderly allowance or other allowances, and they may be receiving special grant for severely handicapped allowance, they will all be able, their carers will all be able to receive the living allowance. So we want to help the carers from different perspectives. That's what I want to supplement.
Now it's my turn. Undersecretary. Dr. Low, the Secretary for Health, have promulgated the new charges for hospital service. I know that PWDs are suffering from different types of illness. Dr. Low, Secretary for Health, said that they don't want people to sell their property just to treat their own illness. And that's why they want to reform the hospital fees to help those in need. Now, coming back to carers and persons with disabilities, I think that the government adopt the same principle. We don't want the PWDs to need to sell their property to meet their medical fees. That's why we've been talking about our support for low-income families. We have different types of disabilities. I've come across persons with disabilities in the middle class. Ms. Kong made a great point. The needs of persons with disabilities is very diverse. We cannot just help those with low income. For wheelchair users, they may be suffering from rare diseases. And their conditions may not deteriorate very quickly. Some of the people with rare disease, their conditions may deteriorate progressively. They need medical equipment and consumables, rehabilitation facilities, wheelchairs, assistive devices. I think that the means-tested scheme will not be able to help this group of patients because some of them told me that the repair and maintenance of rehabilitation devices are not subsidized. I know that we do have charitable funds in the social welfare sector, and some companies donate equipment to PWDs. But we don't have schemes under the government. I don't think that we should rely on time-limited funds offered in the community. Should we, say, offer rehabilitation vouchers to help persons with disabilities? Thank you. Commissioner, please. Madam Chair, in terms of rehabilitation services, the government has dedicated much resources. I think that we're talking about $12 billion in the coming year. We want to take care of the majority of the PWDs as well as their needs. At the same time, we want to encourage social welfare organizations to contribute so that we can develop a mutual help spirit. We welcome and we encourage charitable funds to help people in need. Madam Chair, you also raised this point. on subsidy for PWDs. Most of them are means tested, but they don't come with asset assessment. For CSSA, applicants, they are subject to both income and asset assessment. Commissioner, I have a follow-up question. Some patients told me that even when they receive the higher disability allowance of $4,000, that's not enough to cover the purchase of medical equipment or consumables. Some patient groups who are in wheelchair are faced with the difficulty in repairing the wheelchairs. They rely on themselves to seek friends and companies to donate wheelchairs to them or electric wheelchairs to them. So I wonder if the FWD have numbers on the number of electric wheelchairs users in Hong Kong. And there's a program on TV saying that the wheelchair users actually rely on donations when their wheelchairs become damaged. Should we ask the PWDs to beg for electric wheelchairs here and there? Wheelchair users have physical disability. So I think that the administration should look into how they can help this group of people out. Assistant Director, please. Mr. Ng. Thank you. On the repair of electric wheelchairs and the relevant expenses, we do have a one-off grant for purchasing or repairing wheelchairs provided for in the community. Some of these grants are offered by service units of the SWDs. The subsidy will be able to cover expenses for purchasing or repairing wheelchairs or related medical and rehabilitation supplies. We need expert knowledge to repair electric wheelchair. We don't encourage the PWDs to repair their wheelchair on their own. They need to engage clinicians. That's why some organizations offer wheelchair maintenance and repair services to PWDs. We're talking about wheelchair users who are not receiving CSSA, because under CSSA, all the expenses involved for purchasing or repairing wheelchairs will be covered. As long as they can provide a proof, the expenses can be reimbursed under the CSSA scheme. For non-CSSA recipients, as mentioned, we have charitable funds that offer to cover relevant expenses. As for relevant medical and rehabilitation supplies and the relevant subsidy schemes, well, actually, we do have a special subsidy scheme for the purchase of medical consumables. It is subject to an income assessment. Thank you. Assistant Director, I know that some organizations offer repair services for wheelchairs, but some PWDs told me that the repair takes a few weeks or months even. These PWDs live in the community. Without the electric wheelchair, they won't be able to move around, and that affects their lives. And as a result, some patient groups try to change the parts of the wheelchair on their own. This is a very common scenario. I don't think that we should ignore it. There are organizations who offer rental services of wheelchairs, because most of these electric wheelchairs are tailor-made. The wheelchairs for rent may not completely suit the needs of individual PWDs, but I think that they are suitable for transitional needs of the PWDs. So I think that you should let the PWDs know about the information because they may not be aware of such rental service. They may be stuck at home just because their wheelchairs are taken for repair. Thank you. No more members requesting to speak. I thank the administrations. Any other business? The next meeting will be the last meeting of this subcommittee. Since the June 2024, the subcommittee organized 7 meetings, including 1 public hearing on support service and planning for persons with disabilities. The date of the next meeting will be decided later on. We are going to inform you in due course. Next, visit to Siloam Integrated Rehabilitation Services Complex. I thank the arrangement of the administration and the secretariat. The panel on welfare services and the subcommittee are going to meet to visit the Siloam Integrated Rehabilitation Services Complex on the 15th of April 2025, Tuesday. The complex is jointly operated by Tonghua Group's Hospital, SAHK, New Life Psychiatric Rehabilitation Association. They offer residential care services and daytime training services. All LegCo members are invited to join the activity. The information has been sent to members. Any other business? There being no other business, the meeting is adjourned. Thank you.